and hygiene. Hi, my name's Caitlin Walsh. I'm a student nurse at Harper College. Is it okay if I do a head to toe on you?
Yes.
Okay, give me your name and date of birth, please.
Dan 42993.
And where are you right now?
Harper College Hospital.
Do you know what year it is?
2019.
And who's the president?
Trump.
Okay, so the patient is awake and alert. He's oriented ×4. I noticed his skin color and his speech while I was testing that. And previous to this, we did the Snellen chart, which tests cranial nerve 2 for his visual acuity. And his height is 5'8", his weight is 165 pounds, his BMI is 25, his blood pressure was 116/74, heart rate was 72, respirations were 18, temperature 98.3, and oxygen saturation was 100% on room air. So next, I would start with inspecting and looking at the size and shape of the head, and then I would inspect and palpate the skull and the hair. And then I would look at facial symmetry for cranial nerve 7. Can you smile? Frown? Raise your eyebrows? Squint? Okay, and I would notice the symmetry of his eyebrows, eyes, nasolabial folds in the corners of his mouth. Then I would inspect and palpate the external ear and inspect the auditory meatus. And then I'm going to do the whispered voice test, which tests cranial nerve 8. So I'm going to whisper something. I want you to repeat it back. Blue shirt.
Blue shirt.
Blue pants.
Blue pants.
Okay, so cranial nerve 8 would be intact. I'm going to palpate the temporomandibular joint. If you could open up, close. Any pain?
No.
Okay, and then I would palpate the maxillary sinuses and the frontal sinuses. Any pain?
No.
Okay, and then I would inspect and palpate the nose for any pain, tenderness, or lesions. And I would note the symmetry of the nose. All right, I'm gonna test the nasal patency. I could have you plug one nose and breathe in. Do it again, on the other side. Okay, good, so that tests the patency of the nares. Next, I'm going to do the eyes. So first, I will test cranial nerves 3, 4, and 6 by doing the 6 cardinal positions of gazes and accommodation. So just follow my finger. Keep following. Okay, good. And then also cranial nerves 3, 4, and 6, I will do the pupillary light reflex, so just look straight forward. Okay, good. Next, I'm going to inspect the conjunctiva and the sclera. If you could pull just your eyes down and look up. Okay, and I would look for the whiteness of the sclera and the pinkness of the conjunctiva. Good. Next, I'm going to do the mouth. I would inspect the lips for like color, any cracks or lesions, smile. I'm looking at the teeth and the gums to make sure there's no gum disease or anything like that. And then I'm going to look inside, if you can open up. I'm looking at the buccal mucosa, the dorsal surface of the tongue, lift your tongue, the ventral surface, the roof of the mouth, the soft palate and the hard palate, and the uvula. If you could stick out your tongue and say ah. I watch for the uvula and soft palate to rise, which tests cranial nerves 9 and 10. You stick out your tongue. All right, and that's testing cranial nerve 12, checking the midline of the tongue. Next, I'm going to assess I'm going to palpate the lymph nodes on the neck. So first I got preauricular, postauricular, occipital, submental, submandibular, jugulodigastric, superficial chain, deep cervical chain, posterior cervical, and if you can kind of just shrug your shoulders forward, and subclavicular. Okay, I would check for lumps and masses while doing that. Next, I'm going to check the range of motion of the neck. You could look down, chin to your chest, look up, look to the side, the other side. You do your ear to your shoulder, both sides. Can you shrug against resistance? All right, and that's testing cranial nerve 11. Next, I'm going to palpate the carotid pulses one at a time. Okay. Okay, and then I'm gonna auscultate using the bell of my stethoscope. I'm gonna listen to the carotid arteries. I would listen for any bruit, which we don't want. Oh, if I could have you inhale, and then when you exhale and hold it. Same thing. Okay, good. If I could have you take your shirt off for me. All right, now I'm gonna look at his upper extremities. I would inspect the skin, note the color, the temperature, and I would look for any lesions or abnormalities. And then I'm going to feel the radial pulses. Okay, I'm gonna check the fingers. I'm looking at the nail beds and the profile sign to make sure it's less than 160 degrees. And then I could check capillary refills on all the fingers, make sure they're less than 2 seconds. Okay, and then I'm going to test range of motion. So if you can have your hands out, put them up, put them down, open your fingers wide, close them, and then just the fingers down and back up. Okay, if you can do a bicep curl for me. Okay, and then pull up against me. Okay, and push. Squeeze my fingers. All right, can you stand up? We'll do range of motion of the shoulders. Take your arms, go in a circle up behind your head, and then back down. And then if you want to face this way, so you can go up with your arms, back down behind your back. Okay, good. Now I'm going to look at the chest. I'm inspecting the anterior chest, and I'm noting the rate, rhythm, and depth of his respirations. I'm looking for use of accessory muscles. And then I'm inspecting the posterior chest. I'm looking for the cone shape, the symmetry, any lesions. And then I'm going to listen to the lung sounds with the diaphragm. So take deep breaths for me. All right, if you can stand up, I'm gonna listen posteriorly to the lungs. All right, I'm gonna listen to the right lateral. Okay, turn the other side, left lateral. Okay, and I would be listening for any crackles or wheezing, rhonchi, or any abnormal sounds. And then, so I listened to the bronchial breath sounds, the bronchovesicular, and the vesicular breath sounds. All right, I'm gonna have you lay in bed. So the head of the bed would be at 30 to 45 degree angle to inspect for the jugular vein distension, if I can have you look that way. All right, and I'm looking to make sure it's flat. Look this way. I'm looking on this side as well. And then I'm going to listen to the apical pulse. All right, and then using both the bell and the diaphragm of my stethoscope, I'll listen to the aortic, pulmonic, and tricuspid and mitral areas. All right, and now with the bell. Okay, and while listening to the heart, I was listening for the S1, S2, or the love dub sound. No extra heart sounds or murmurs like that. Next, I'm going to move on to the abdomen. So from the side of the bed, I would look at the contour. And then from the foot of the bed, I'd look at symmetry. Okay, I'm gonna inspect the skin and note any lesions or the skin characteristics. I would inspect the umbilicus. I would also note any pulsations, like aorta pulsations could be normal. Next, I'm going to listen with the bell of my stethoscope. I'll listen to the aortic artery and the renal arteries for vascular sounds. Okay, and then I'll use the diaphragm and I'll listen to bowel sounds in each quadrant. Okay, bowel sounds are present. Do you have any pain in your abdomen right now?
No.
All right, so first I'll palpate lightly for any lumps or masses, any tenderness. Then I'll go deep. All right. Then I will move on to the lower extremities. So I'm inspecting the skin for any lesions. I'm looking at the skin, the hair distribution. I palpate the temperature. All right. And then I'm assessing for any pretibial edema. Okay, and then I'm gonna look at the capillary refills. All right, I'm going to feel the pedal pulses. Let's move this a little bit now. All right, and while we're here, I would test the Babinski reflex. I would have a reflex hammer, and I would just test. I would note any curling of the toes. We just wouldn't want them to flare up. Next, I'm gonna test range of motion. So I'm gonna have you take your right leg and bring it out. Bring it back in. Bring it up. Bend your knee. Bring your knee out and in. All right, back out. Same with this one, bring it out, back in, bring it up, bend your knee. Knee out, knee in, and back. All right, I'll have you push this leg against me. All right, push it in. Push this one in, push this one out. All right, I'm gonna do the flexion and dorsiflexion of the feet, plantar and dorsiflexion. So pull up, push down. Okay, good. I'm gonna have you stand up, and we'll do the knees. Make sure this is in it. All right, so if you want to just face front, bring your knee out, bend it, out and bend it. Okay, good. And then now we're going to do the neurological assessment. So you can sit back down if you'd like. So I'll do the light touch. I'll have you close your eyes, and then I'm going to take this cotton and you're just going to tell me where you feel the touch, okay? Close your eyes.
Forehead, left cheek, chin, right arm, left arm, right leg, left leg, right foot, left foot.
Okay, and that was testing the neurological function. All right, and then I'm going to do a sharp dull discrimination. So this will be sharp, this will be dull. So you're going to have your eyes closed. You'll just tell me if it feels sharp or if it feels dull.
Sharp, dull, sharp, dull, sharp, sharp, dull, sharp, dull, sharp, sharp.
Okay. Next, we're going to test the cerebellar function. We're going to take your fingers and put them to your thumbs as fast as you can. Okay, and then do to your nose to my finger as fast as you can. All right, want to switch? Okay, good. Earlier when I looked at the eyes, I noted that the pupils were equal, round, reactive to light and accommodation. Now, since while you're sitting, if you want to just take your heel and rub it down your shin, Same with the other side. Okay, good. Can you stand up? Now I'm going to test your gait. If you can just walk normal that way. On your way back, do heel to toe. Okay, and then we're gonna do the Romberg test. If you wanna stand with your feet together, eyes closed, arms out. Just stand as still as you can for 20 seconds. Okay, great. You wanna take a seat? Also for the lower extremities, can you hold both your legs out for 5 seconds? 1, 2, 3, 4, 5. Awesome. Okay, now I'm going to do the deep tendon reflexes. So I would have a reflex hammer. I would look for the tendon of the biceps and do the bicep reflex. I would hit it and know any movement of the fingers or the arm on both sides. You'd relax in my arm. I'd hit it and it'd move. Wow. And then I would do the quadricep tendons. Note the tendon in the leg. Hit it and look for any movement of the feet and the leg. Okay, good. Then I would move on to the spine. So I'm gonna have you stand up. I would look at the thoracic curve, which should be convex, and then the lumbar curve would be concave. And then I'm noting the straightness of the spine while standing, and then if you could bend over, touch your toes. All right, I would also note the symmetry and the straightness of the spine while bending. Then we'll do range of motion of the spine. You can put your hands on your hips. Can you move to the side and to the side? And then spin without turning your hips to each side. Okay, and that concludes our head to toe assessment.